Bordetella pertussis, the whooping cough. Bordetella pertussis is a bacterial infection of the human respiratory tract. The whooping sound, which is caused by a high-pitched inhalation after a coughing fit, is the hallmark symptom, although it does not have to occur during every manifestation of a disease. It was one of the most deadly childhood diseases in the U.S. during the 20th century, but it can affect people of all ages, although it is normally referred to as a childhood disease because infants and young children are most susceptible. The vaccine has decreased the incidence by 75%, although it is still a problem in developing countries. Worldwide, there are 16 million pertussis cases and about 195,000 pertussis deaths in children per year. Adolescents and adults are common reservoirs of the disease. They may be asymptomatic and remain undiagnosed, but they can still infect infants. Characteristics of B. pertussis. It was discovered in Paris in 1906 by Jules Bordet and Octave Genot. It is a non-motile, strictly aerobic, gram-negative bacterium with a coccobacillic shape that does not produce spores. The figure on the right depicts a false color transmission electron micrograph. It is a mesophile, which is important because that means it can thrive in the mucous membranes of the human respiratory tract. This is a bacterium that only infects humans. It can also survive on surfaces outside the body for a couple of days, although the normal mode of transmission is through respiratory droplets, which makes this disease very contagious and easily transmitted. Laboratory tests can be carried out to confirm the diagnosis. A culture of the bacterium can be taken, or a polymerase chain reaction can be used, which is a test that identifies the genetic material from the bacterium from nasal secretions. Pathogenesis. The whooping cough is a toxin-mediated disease. The pertussis toxin is specific to pertussis, and it helps invade host defenses. The filamentous hemagglutinin, FHA, agglutinogens, adilate cyclase, protactin, and tracheal cytotoxin are among the other toxins that are secreted. These toxins paralyze the cilia and the epithelial cells of the respiratory tract, which causes inflammation that impedes the clearing of mucus secretions. These antigens also prevent chemotaxis and promote lymphocytosis, which is the production of lymphocytes. Bacteria invade tissues and are found in the alveolar macrophages. This figure depicts the synergy between PT and FHA. They together paralyze the ciliary movement of the cilia, and this impedes the clearing of mucus in the respiratory tract. Hallmarks of the disease. It's broken up into 3 stages. The first stage is a catarrhal stage, which lasts around 1 to 2 weeks. Its symptoms resemble the common cold, which makes the disease tricky to diagnose during the early stages. It's also the most contagious period. The paroxysmal cough stage is characterized by the coughing attacks, which are followed by the whooping sound, and it sounds something like this. The convalescent stage is the last stage and is a recovery period. It can last for weeks or up to months. Historically, the whooping cough has been referred to as a 100 days cough because it can last up to that long. Neurological issues such as seizures and encephalopathy can also occur, usually in young children, from lack of oxygen supply, which is known as hypoxia. A secondary bacterial pneumonia is the most common cause of death. This figure depicts the relationship of B. pertussis and the antibodies that are produced. It shows that the catarrhal phase is the most contagious portion, and that the intensity of coughing peaks during the paroxysmal stage, and that the percent of antibodies increases at the convalescent stage. Treatment. Antibiotics are administered to anyone who's had the disease for less than 3 to 4 weeks. Common types of antibiotic prescribed are zithromax, Biaxim, and erythromycin. Antibiotics are not proven to be effective for patients who've had the whooping cough for over 4 weeks. Also, antibiotics are given to family members and other close contacts of the patient in order to minimize transmission. Patients also require bed rest, increased fluid intake, and fever monitoring. Prevention. The whole cell pertussis vaccine was developed in the 1930s and it was used until 1945. It's no longer available in the U.S. because of local adverse reactions it would cause, such as swelling and redness at the site of infection. It is combined with diphtheria and tetanus toxoids, so it was referred to as a DTP, and it is about 70 to 90% effective after 4 doses, and the protection lasts between 5 to 10 years. The purified acellular pertussis vaccines are what we use in the U.S. today, and they are associated with lower frequency of adverse reactions. There are 2 types. Both are combined with the diphtheria and tetanus toxoids, and neither of them use thimerosal as a preservative. The DTaP is the pediatric version, and it is administered in 5 doses, occurring at 2 months of age, 4 months, 6 months, between 15 and 18 months, and between 4 and 6 years old. The Tdap is the adolescent and adult vaccine. It's first administered in 2005, so it's a little more recent. The first dose is administered between the ages of 11 and 12. It is recommended for pregnant women to receive this vaccine so the mother can pass some of the protective antibodies to the fetus, and it also protects the child under 2 months of age because the first dose of the DDaP, which is the pediatric version, is administered at 2 months. Trends in future outlook. The incidence gradually declined because of the whole cell pertussis vaccine in the 1940s. However, it started to increase again in the 1980s, which could be due to anti-vaccination movements. The disease peaked in 2001 and 2003. The changing epidemiology of pertussis has also caused increased amounts of cases in fully vaccinated children and adolescents, which could be due to the transition to acellular vaccines in the 1990s. So some are speculating that maybe the whole cell pertussis vaccines, although they had more adverse reactions, might have been more effective. Pertussis still remains one of the leading causes of vaccine-preventable deaths worldwide. Most deaths occur in young babies in developing countries who have never received the vaccine or have been incompletely vaccinated because the vaccine is administered in 5 doses. It needs to have all 5 doses to be effective. And here are a list of sources.